Hi guys, Tony here, the head physical therapist and CEO of Off the Block Physical Therapy. So today we are here to talk about the glute med, or this lovely little tiny muscle that hangs out under the biggest part of your hip musculature here and attaches to that pesky IT band and likes to cause runners, especially, knee pain down here on the outside. So the best ways right now that we know to strengthen the glute med are in the most functional positions for runners. So runners spend a lot of time in this single leg position here, jumping essentially from one leg to the other. So some of the best ways to strengthen the glute med to really make it functionally applicable for running is in that single leg position. So I'm going to show you a couple of our most frequently prescribed exercises here today that we give runners who are experiencing knee pain or who want to avoid knee pain in the future and really want to condition their glute med properly. So the first exercise that we have here today is called a hip hike. You're going to get a surface slightly higher than the floor, so a step stool or something like a stair would work perfect. And what you're going to do is you're going to put your one foot on the stool and one foot hanging off the stool. Now, it's important to keep in mind that the glute med that you're working is on the standing leg, not on the leg that's hanging off the stool. But what you're going to do is you're going to try your best to keep your balance, and you are going to lift and lower your hip. Woo! Apparently I need to work on my glute med here. So lifting and lowering and lifting and lowering this hip here. So you're going to lift it up higher than the opposite hip and then let it lower all the way back down because we really want to work that full range of motion. Lift and lower. While you're here in this position, there's another exercise that you can hit right off the bat, and that is a step down, a single leg step down. So this time we're working kind of that quad and also that glute med to keep our hips stable and level. So ideally, if you can do this in front of a mirror, you're going to get really good results for both of those muscle groups because you're going to try to keep that hip at the same height. You're going to lower down and then come back up, and lower down and come back up. So those are two on the step here. Another really great exercise that works especially functionally for running is to start on a single leg and hop forward. Woo! And ideally, oh my gosh, keep your balance here. So starting here. As you guys can see, I'm a typical runner with a not so sweet glute med. Forward, balance, hold, keeping those hips nice and level, and back. Over and over again, jump, hold, and up. Repetitive, you can switch to the other side, jump and hold. A little better on this side. And jump and hold. Good, so that's another one, that's 3 so far. We have one more, super important, if you have one of these little TheraBands, nice and helpful here. So, put the TheraBand down around your feet. Drop into a squat position, so you want to keep it nice and low. You don't want to be up too high because that's going to target a different glute muscle, and you really want to keep it in this squat position. So you're going to hold tension on the band here. You're going to step out and in and out and in, never fully letting the tension on the band go away. So back and forth here. These are called monster walks. And after a couple of steps back and forth, you will really start to feel the burn in the side of those hips. That's that glute med working. So the way that we recommend that you do these exercises, the way I like to do these exercises is in sets of 10 to 12 and kind of do them in a cycle. So you'll do the hip hikes and then the step downs and then the monster walks and then the jump forwards. And you'll do one set, 10 to 12 on each side, but all of those exercises. And you go for like 3 or 4 rounds, really until you have totally fatigued out those muscle groups. And if you throw that into your training, a couple times a week, still running, still keeping up the actual activity that you want to maintain, you'll see some pretty significant improvements, hopefully in your knee pain, but also in the stability in your hips just throughout your gait cycle. So those are our 4 most commonly prescribed exercises for runners with that lateral knee pain. Check back in 2 weeks for another blog post. Thanks, guys.